Hi, my name's Rachel Seward, and I'm going to be talking about the background of Virginia Henderson. So, Virginia Henderson was a nurse, teacher, author, and researcher of the 60 years of her career. She accomplished a lot throughout these 60 years. She was the best known for her. She was best known for her definition of nursing. Many called her the Florence Nightingale of the 20th century because of this personal definition of nursing that she later got published. I believe that this was a very big honor for Virginia Henderson because Florence Nightingale in the 1800s was considered to be the person that basically laid the foundation for the theories on nursing. And throughout the next couple centuries, people built upon these theories and created their own. So I again believe that was a pretty big honor for her. Her first publishing of her definition was released in 1955 and was revised in 1966. So, according to Henderson, the role of the nurse involves assisting the patient to perform activities that contribute to health, recovery, or a peaceful death, which the patient would perform without assistance if the patient possessed the necessary strength, will, or knowledge, and to do so in a way that helps the patient gain independence rather than remain dependent on the nurse. So, again, this is just an overview of the background of Virginia Henderson. So, next, I'm going to be talking about the impact of Henderson's theory. Henderson was very passionate about her theory of nursing and believed it to be a form of art, as well as an empathetic understanding by stating a nurse should be very close to their patient to be able to understand their needs. She gave an example of being literally in a patient's skin, that's how close you should be to your patients to be able to understand what their needs are and how well that you need to be taking care of them and providing them the best care that you can give. She also believed that nursing is a combination of one's heart, hands, and head. I feel like this is a really good example of what nursing really is and how a nurse should be handling their patients. They have to have their heart, they have to have compassion, they use their hands physically, and they have to use their head in tough situations. So, their knowledge and what their knowledge was built on. Henderson later came out with 14 components that she would classify as the basic needs of nursing. And overall, this is the impact of Henderson's theory.
Hey, I'm Mallory, so I'm going to be talking about Henderson's 14 basic needs on which nursing care is based. So, the first one that Henderson brings up is breathing normally. So, basically, you just want to check that your patient has a normal respiratory rate and they aren't having trouble or struggling breathing. The second basic need would be eating and drinking adequately. So, that would just be making sure that your patient has a nice diet and they're maintaining that and they don't have any trouble swallowing or things like that. The third basic nursing care need is eliminating bodily waste. So you just want to assess that your patient is able to do that and they don't have any trouble with that in their day to day life. And then the fourth thing is moving and maintaining desirable postures. So you just want to assess that your patient is able to move and that they aren't bent over or have odd postures or sitting. And then the fifth thing is sleep and rest. So you just want to make sure and ask your patient how their sleeping habits are and if they get tired throughout the day or they feel fatigued, and asking them how much they sleep. And then the sixth thing is select suitable clothes, dress and undress. So that would just mean assessing if the patient is dressed appropriately depending on the weather and they're wearing what they should be wearing, like not wearing shorts when it's 30 degrees outside. And then the seventh thing is that your patient maintains a body temperature within normal range by adjusting clothing and modifying the environment. So you just want to check their temperature, make sure that it's in the normal, and ask them if they ever feel like they're overly hot, overly cold, just making sure they stay in that normal range. So, yep. Okay, and to pick up off the last slide, these are the next 7 basic needs on which nursing care is based. So number 8 is keeping the body clean and well groomed and protecting the integument. So that would just be making sure that your patient has good hygiene and has good self-care habits and they keep up with that. And then the 9th thing would be avoiding dangers in the environment and avoid injuring others, which I feel like that's kind of self-explanatory, avoid danger. So And the 10th thing is communicate with others in expressing emotions, needs, fears, or opinions. So that basic need would just be making sure they have a community where they're able to talk to others about their emotions and how they are feeling. And then the 11th thing is worship according to one's faith. So you could ask your patient if they do have a religion and the ways in which they apply that to their lives and how that is incorporated into their life. And then the 12th thing would be work in such a way that there's a sense of accomplishment. So that would just mean that you ask your patient like how they work for their job and do they feel like they are accomplished throughout their day and they aren't just doing this to get by, but they actually enjoy what they're doing. And then the 13th thing would be play or participate in various forms of recreation. So that could just be having a book club or playing sports recreationally, just having some fun things to do outside of just day to day life. And then the 14th thing would be learn, discover, or satisfy the curiosity that leads to normal development and health and the use of available health facilities. So that would just be looking into health facilities, screenings you can get done, or just if you are curious about something, figure it out and find someone who can help you with that and answering those questions that you have. And so that's all.
Hey, my name is Arabella Clark, and I'm going to be talking about the application of Henderson's 14 components of basic nursing. Henderson's 14 components of nursing care in the context of the nursing process are directly related to the application usage in a clinical situation. So, in the assessment phase, a patient is assessed by using the 14 basic needs. In the planning phase, the nurse will create a plan that relates to gaining their independence rather than depending on the nurse. In the implementation phase, the nurse will help the patient perform exercises to maintain health, regain from illness, or ensure the death is peaceful. Lastly, in the evaluation phase, the nurse will evaluate the patient's needs were met or not met, and with or without the assistance of a nurse. Hey, my name is Arabella Clark, and I'm going to be talking about the theory-based clinical situation. So the clinical situation is a woman, 62 years old, comes into the hospital for a yearly checkup. In the assessment phase, the patient is assessed with the 14 basic needs. The patient expressed lack of sleep and feeling fatigued. After further assessment, she stated that she was trying to quit smoking and is using a nicotine patch. In the planning phase, the nurse creates a plan to replace the nicotine patch with an inhalator due to possible side effects regarding her fatigue and lack of sleep. In the implementation phase, the nurse gives patient education for the use of the inhalator and why the nicotine patch could be affecting her sleep pattern. In the evaluation phase, the patient needs were met after having a follow-up appointment 3 months later with decreasing assistance of the nurse.
As a group, this is our personal philosophy. As a whole, we believe that Henderson's philosophy and her 14 components of basic nursing care is how a nurse should go about her daily job as a nurse. We think that her emphasis about nursing being an art and an empathetic understanding on how a nurse should know their patients well enough to understand their needs will be important throughout our nursing careers. Thank you.